My name's Stefan Mazy. I'm the CEO and founder of a company called DermR Health Solutions, and we are developing a brand new way to test for skin cancer without actually a biopsy and without doing histopathology either. It's literally a whole new way of looking at skin cancer.
All right, tell me more.
So tell you more. All right, so where to begin? So I suppose our company is broken up into sort of little segments. So on the one hand, we are in or considered Industry 4.0 manufacturing, where we've developed a very unique way of manufacturing these tiny little microneedle structures. And what's cool about these structures is that they can penetrate the skin and you don't feel anything. So for those people who have needle phobia or fear of blood, like, we tick all those boxes. But the idea is that you apply a bit of pressure onto the skin. These little structures penetrate the skin maybe about 1 millimeter long or a millimeter in depth. And then when you remove them, these little structures collect several skin cells. So it's a live tissue. And from there, we can actually send that to a lab. And we've developed a gene assay that can screen across a spectrum of skin cancers and detect tiny gene changes within this tissue to indicate if this lesion or if these cells are cancerous. And the reason for this is about 40% of skin cancer biopsies are actually benign and could have been avoided. Now, 40%, it does sound like a lot, but when we put it into sort of larger numbers, there was about 600,000 avoidable biopsies that were performed in Australia.
Alone.
Just last year.
Yeah.
So, I mean, these are really big numbers. And collectively, I mean, skin cancer is the leading global cancer. So if you combine all types of skin cancer, including the underreported basal squamous cell carcinomas, like, it is literally trumping every other cancer around the world.
Amazing. So fine for those with needle phobia.
Yep.
Cheaper in terms of pathology? I imagine a cost saving there.
Yeah, so we're looking at about 30% cheaper than pathology. We're not taking money away from pathology. I think that was the biggest thing, because people keep saying, oh my God, you have to be careful because pathology own this industry. And I'm like, well, they do own the industry, but there's also a really known backlog for biopsies. We've spoken to so many pathology firms, and constantly the struggle is backlogs. I mean, this is where your liquid biopsies basically evolved because of a backlog in biopsies. And we're sort of helping to change that as well, because one of the biggest things is, 600,000 biopsies could have been avoided. There could have been a whole new way of doing it, which means that people could have had access to better healthcare much quicker.
Yep. So many applications there. And does that, I'm just having a think, so in terms of, I guess, most GPs that will take skin biopsies or take them out, there has to be some sort of procedural space in that. Does that then allow the scope of every GP to be able to utilise this testing?
So here's the thing. Right now, we've found that about 20% of GPs actually don't perform biopsies just because of training. I mean, I've seen biopsies, and they're a lot more full-on and graphic than I had anticipated. It takes about 30 minutes. So it's a full-on procedure to cut it out. And where our solution basically fits in is it's the same item code as a biopsy, so the doctors aren't losing money. They could perform the procedure in about 5 minutes as opposed to 30 minutes, which means doctors can actually see more patients in less time and actually increase their billable hours without actually causing unnecessary pain and suffering to the patient. It's sort of like a win-win all around.
Yeah, absolutely, for everyone. Yep. Brilliant. So you've been here, we're at ARCS today, and you've been participating in the BioBeacon aspect. Can you tell me a little bit more about that and your participation in BioBeacon?
I mean, look, it's been pretty interesting. I mean, we've to us, it sort of seems like we've popped up out of nowhere.
Yep.
We've actually been sort of in stealth mode for about 4 years. And so ARC is the very first time we're actually being vulnerable and we're presenting in front of clinicians. So, we've spoken to clinicians here and there, we've spoken to doctors, and we know generally that it's okay. But I think this is the first time we're in an audience where they're mainly clinicians.
Yep.
So their job is, to listen, but also to try and tear us apart to figure out if there are any holes in what we're doing. So it's kind of fun. I kind of think we're prepared, but I really hope at the end of it, whatever the feedback we get, it's going to be able to help us move to the next milestone.